everyone, I am Jamelyn Becao, your student nurse. For today's video, I'll perform a Retdem demonstration to assess the abdomen. But before we hop onto that video, let me show you what equipment we'll need for today's assessment. So without further ado, let's get started. So before performing this procedure, we have to perform proper hand hygiene and don our PPE if necessary. After that, we can now proceed to the assessment. Good day, sir. I am Jamie, your student nurse from Our Lady of Fatima University. So, sir, for verification, can I ask what is your name?
Cedric J. Tubat,
And when is your birthday?
November 4, 2002.
How about your age, sir?
I'm 20 years old.
So that is the first thing that we need to do. We have to identify our patient for us to ensure that it is the right patient in front of us. If there are any curtains or any doors in the room, we have to close them as well in order to provide privacy. Then after that, we have to explain the procedure to the patient. Okay, sir, I'm here to perform an assessment on your abdomen, and for me to able to assess those parts, I will need to inspect, auscultate, percuss, and palpate. Is that okay with you, sir?
Yes.
Alright, rest assured, sir, that all of the documents are completely confidential between the attending physician and me. So, do you have any questions, sir, before we start?
None.
Okay, but if you have questions later during the assessment, don't hesitate to ask me.
Okay.
I already perform hand hygiene and provide privacy for the patient, and now I'll be starting to perform and assess the abdomen of the patient. So we're going to assess the abdomen, and remember, we're switching our sequence and how we assess. We're going to do inspection, auscultation, and then percussion and palpation. So whenever you're looking and assessing the abdomen, have the patient lay on their back, and what we're gonna do is we're going to inspect the abdomen. And first, I want to ask, sir, are you having any stomach issues at all?
No.
Okay, and when was your last bowel movement?
Yesterday morning.
And how are you urinating? Do you have any pain while you're peeing? Do you have problems starting a stream and a discharge, anything like that?
None.
Okay. And with your male patients, you want to ask about that due to prostate enlargement, starting a stream, and if he was a female, I would ask him when his last menstrual period was, and ask again about urinating and things like that. Now, if the patient has a falley, this is the time when you would want to look at the urine, inspect the falley, and look at that. Just conglomerate your urinary system with your GI system together. Okay, so we're inspecting the abdomen. We're looking at the abdominal contour, and this patient is scaphoid. It goes in a little bit. You can also have flat, rounded, or protuberant. And also, we're going to know if there are any pulsations a lot of times in this area right here on thin patients. And I can see the aortic pulsation in this patient is right above the umbilicus, and looking at the belly button and checking for any masses. Do we see any hernias or anything like that? Also, if your patient had any wounds, you wouldn't want to look at that. And if they have a peg tube, you wouldn't want to assess the site to make sure it's not red, and ask them how it feels. And with your ostomies, you want to look at the stoma and make sure it is like a rosy pink color. It's not a dusky cyanotic color. It's not prolapse, and look and see what type of stool it's putting out, and note the smell, note when if the bag needs to be changed, anything like that. So now we're ready to listen to the bowel sounds, and what we're going to do is we're going to listen with the diaphragm of our stethoscope, and we're going to start in the right lower quadrant and work our way clockwise, and we're gonna listen to all four quadrants, and you should hear 5 to 30 sounds per minute. And if you don't hear any bowel sounds, you need to listen for 5 full minutes, and you need to note, are these normal, are these hyperactive, or hypoactive? So let's listen. Okay, this is your right quadrant. We're gonna move out to the right upper quadrant. Move over to the left quadrant. And then down to the left lower quadrant. And vowel sounds are normal. Now we're gonna listen for vascular sounds, and you're gonna do this with the bell of your stethoscope. And we're gonna listen at the aortic, we're gonna listen at the radial arteries and iliac arteries, and you could listen at the femoral arteries if you needed to. So you're gonna listen at the aorta artery, and it's a little bit below the xiphoid process, a little bit above the umbilicus. So about right here, and we're listening for like a blowing swishing sound that would represent a bruise. Okay, none and noted. Then we're gonna listen at the right and left renal arteries, which is a little bit down from the aorta location. So here's right. Okay, none and noted. And then over the left. Then we're gonna listen at the iliac, and it is a little bit below the belly button right here. And this is the iliac artery. And then listen to the other side. And again, like I pointed out, you could listen at the femoral artery and the groin if you need to. Now we're going to do palpation. First, we're going to do light palpation, then deep. And as I do this, please tell me if you feel any tenderness or pain. So first, we're gonna do the palpation. We'll just start in the right lower quadrant and work away around, and you're gonna go about 2 centimeters, and you're just feeling for any rigidity, any lump or masses, anything like that. How's that feel?
Good.
Okay, now we're gonna go deep palpation, and we're gonna go about 4 to 5 centimeters, so a lot deeper. Then again, you're just feeling for any masses and lump, and then tell me if you feel any tenderness, and sometimes you can do this with 2 hands if needed. Feeling anything?
I'm feeling fine.
Feels nice and soft. Heard some belly sound. That's why you need to do this after you listen, because you stimulated. Okay, everything is good. So that wraps up on how to perform an abdominal assessment. Thank you so much, sir, for your cooperation, and have a nice day. So I will ask my patient to change his patient gown into his clothes, and I'll be performing proper hand hygiene. Also, if there are any signs of abnormalities, we want to refer them to other healthcare provider for further evaluation. After that, we are now done with the assessment.